Do I need labs as I get treatment? No, you don't need labs. Remember, 8,000 years ago, what did we use? We used our own type of CT, MRI, blood work. What did we use? We used the tongue, we used the complexion, we used the pulse, and then asking the most accurate computer. That's you. Me asking you certain questions and you responding a certain way gives me indication to how your complexion, your tongue, and your pulse all match up. So, like in Western medicine, I do a complete exam for you, but then I go get a blood test, then I go get an MRI, an X ray, thermography, whatever. Well, I take all of that data and then I come up with a clinical picture. Well, 8,000 years ago, we take all that data and then came up with a clinical picture. Actually, it doesn't change. Then, when we see the clinical picture change, then as I use interventions, I see your complexion change, I see your tongue change, I see your pulse change, and then ask you, well, hey, how's your pain? How's your condition? How's your different aspects of different things? And from there, I have a baseline in your original assessment. And as I'm doing the intervention, your pulse is changing right then and there in the office. And I can see what the changes are in order to see how your body responds to that therapy. So if you begin to understand that it is a functional way, because nowadays we talk about functional medicine, I can see your body changing in real time. So in the hospital I trained in, we actually did blood work 4 times a day. Oh, why would anybody do blood work 4 times a day? Because at different times, remember, the president of the hospital was a time specialist from midnight to dawn to noon to dusk. Your body secretes different types of hormones, body fluids, cells, all kinds of things. So what happens is that when he was doing his particular research in type 2 diabetics that had no islets, and what are islets? Islets are the actual cell that produces insulin. So these particular people had no pancreatic islets. So he would make sure that at the appropriate time, when the organ was the best energy, he would harmonize with certain planets, write a prescription, and then what was the result of that? What the result was is that their pancreas started to produce those islets again, those cells. So we can actually use the magnetic waves, we can use the ionic waves of different forces to actually stimulate function in the human body. And that was one of his research projects that he was doing for type 2 diabetics. So when you understand the right time and you're getting the right information at the right time, it actually shows you the highs and the lows. Just like right now, we can go out to the ocean and we can see low tide, high tide. The same thing happens with your body. You have low tide and you have high tide of different hormones and other types of products that your body makes in the body. So, I like to do things in real time, see how your body is responding, and then I can give you a clinical picture that is a proper assessment for you. Remember, when you get a blood test, what happens? They're giving you a picture of a general group of people. So if I'm looking at your thyroid profile, your liver profile, they'll say, oh, between this age and male and female and different things. Well, okay, what does that have to do with you? It has nothing to do with your particular clinical picture, your particular um, constitution. So we have to make sure that we make everything specialized to you, the individual. So that's the difference that I like when I practice Chinese medicine in the daily practice that I do.